Hi, my name's Austin Hunt. I am a consultant in the NHS. I was a founder, trustee and former chairman of Masanga UK. So Masanga UK is a small NGO which we started in about 2008. It was a student-led initiative. Myself and a student called Sarah Patching started the programme, and we aimed to set up a mutual benefit project to benefit Plymouth NHS Trust, its students who are trained locally but to work globally, and to try and give them the opportunity for gaining experience in global health. We linked to a hospital in Sierra Leone. The hospital was called Masanga. It was previously one of the foremost hospitals in West Africa, but it was destroyed in the civil war. So we linked the two hospitals together, and in the course of the last 7 years we've had about 50 volunteers, staff and students visit the project and to take over skills to Masanga, but to also bring back their experience to the NHS. And it's been a really successful program. It's been almost universally lauded by all the people who've taken part in the projects. So we've had junior doctors who've been able to become project managers, building and opening an acute medical unit in rural Sierra Leone. We've had other junior doctors who've been involved with opening Ebola triage centres. So apart from the transfer of skills and the transfer of, we take resources across to the hospital in terms of kit that we're no longer using in the UK, or we take over people with consultant and registrar level skills to, for example, set up their national surgical programme. I can give you a few other examples of the benefits. We've had students who've managed to obtain funding from the Gates Foundation, and they trialled a malarial biosensor. So they've been able to gain experience abroad that they wouldn't have been given the same levels of responsibility. So from my perspective, one of the main benefits is that we are able to gain experience for students and staff in diseases that we won't see generally in the southwest of England. So for example, we had an ongoing project with viral hemorrhagic fevers and infection prevention control in West Africa. So a number of our middle grade doctors and members of staff were able to gain experience in managing patients with suspected viral hemorrhagic fevers, and I think that's been a real skill transfer, bringing back those skills back to the UK, so that when the recent Ebola scare was on and people were travelling in from West Africa or bringing in fevers from abroad, we actually had some members of staff who had some really relevant experience through their time working out in West Africa. As I think that the real benefits of this is that we train up our students in the southwest of England, but we're able to give them experience of diseases of global importance, diseases which exert significant burdens on other parts of the world and they just don't get a chance to see. But by being involved in a mutual benefit programme such as Masanga, they get real experience out there in the field and bring that back to the UK. Our staff have gone out and worked in an environment such as rural Sierra Leone, has brought back benefits back to the acute medical unit. So I think it improves patient experience. You could say that the southwest of England isn't culturally not that diverse. It's mainly a population consisting of a white European background, but when the staff get experience from working with rural Africans, I think that then improves the experience of other patients passing through the unit. So it makes us more culturally aware and hopefully better at our communication skills. Spend all our time